Nursing is to serve people and to serve Christ in all people in their weakest and most vulnerable moments. For some of them, it's something that I wanted to associate my life with, and I wanted to dedicate my life to.
The MEPN program is the Master's Entry into Professional Nursing program, and it was developed out of the need for nurses. There is such a nursing shortage, and so we needed another avenue for students to come into the nursing program and benefit from our skills and expertise and come out with a master's. It makes a well-rounded nurse, better critical thinking, better clinical knowledge, and just an all-around master's level nurse with leadership skills that could either be at the bedside or move up into management a lot quicker.
Being a MEPN student, you're always doing something. We're in class for several days a week, and then a lot of days we're at the hospitals. We usually have simulation once a week. And so in class, usually we're learning the things that we're going to have sim on that week, which is really nice because there's not a really long gap between the time that you are taught the information and then the time that you're expected to practice on the information.
Simulation is with a mannequin or an adult that we've hired to act like a patient, and we learn how to talk to them, we learn how to assess them, how to listen to their lungs, measure their achievements, their development levels, and then practice, giving them medications.
We have more simulations in the master's program than you would in the bachelor's program. It's not just something that's in the classroom, but then it's something that is embodied in practice.
You never know what you're going to go into. Like, that's with simulation and with the real world. Our professors, I think, do it on purpose because we're like, we don't know what's going to happen, but it does teach you to think on your feet and critically think in that scenario.
Our professors really emphasize the importance of patient care and how important it is to be knowledgeable about all of the different diseases or information that nursing includes. When they teach you and you don't understand it, they're very good about seeing you one-on-one to really emphasize the information so you really understand it.
In interacting with my professors, they're just very warm and welcoming. They're very open. They're always saying, come by my office, talk to me. If you have any concerns, don't be afraid to text us. And that's one of the great things is I have all my professors' phone numbers, and I can text them hey, I'm gonna be late to class because I have a flat tire. And they're just oh, okay, take your time, be safe, don't worry about it. And so just the ability to talk to my professors like they're a friend, and that's just very helpful.
I feel like I have a friendship with them, and I feel very comfortable to talk to them if I don't feel confident in what I'm learning. So I think it's a really special thing that Harding has with the professor and student relationship.
In interactions with other nurses that I've had, they're well, I've worked with a Harding student before, and it was you're just so ready to display this skill, and you can just jump right in and do it.
So the NCLEX is something that you're ultimately preparing for throughout nursing school. What I found after taking it and passing on my first try is that this program really prepares you for the NCLEX. And in fact, I found that the NCLEX, the level of questions weren't as challenging as some of our course classes. And I was grateful for that because it really prepared me to really do well and not to be afraid of failure, and to be assured of my success and my next steps in my career, which I'm just very grateful for.
The whole point of Harding is being the hands and feet of Jesus, and in nursing that's especially applicable because I want to be the kind of nurse that goes into a patient's room and takes care of their physical problems, but also takes care of their mind and just shows them through my patient care that they are valuable and that they're loved and that they matter, and that even though they're in this horrible place, light is even there, and Jesus is even in the hospital.